Let's focus a little bit more on the dental world, and with this on the dental market. The implant market used to be the fastest growing market in the dental arena, and I think it's still there. But when we really look at the growth rates we see currently in the market, they are not there where maybe we want to have them. We have today a very mixed picture in the world, where we have a good growth. It's picked up very good in North America, while Europe is very flat. So obviously the economic situation does not really motivate people to undergo treatment, which is some investment from them. Overall, totally, the market is not growing that much that we expected a few years ago. On the other side, we believe that this market will pick up because we don't think that the demand has changed. So basically, if the economies are going better, the market will pick up, as they do currently in North America. We are happy to report that we performed quite well in this market. We are growing the 5th year above market, and our target is to continue. And I have to say thanks to you, because you are the one supporting us. Your partnership and trust in the company and in our services allows us to get to this result. So, nevertheless, I think we have the obligation to bring this real excellent treatment to our customer, and we do that with what we call the three-dimensional offering structure, where we have a base with our implant brands, and on this we develop technologies, solutions which help you to treat the patients, and on top of that we have concepts in place to help dentists all over the world to develop their practice, to manage their patients. I think that's one thing what should help in the future also to grow the business. And I mean, that's what we want. We want to get more people involved in this treatment, the benefit of this treatment. And to reach that and to be really focused on improvement, on better dentistry, we are dedicated, as Fred said before, to R&D and clinical research, because only if you do that, you can improve your products constantly and understand how they are working. When I talk about success, everybody will ask, what is success in dental implantology? And I mean, when you look in the literature, you can find some criteria for that. A very famous one, still valid, is the one from Albrechts and Saab, latest update in 1998, where we say, well, 1 millimeter loss of bone, and then consequently another 0.1 millimeter over the year. This we should see as a success. Maybe that's a little bit driven by our view, how good the implants function, how good they are in place, but we need to understand what the patient wants. And I mean, we agree that the patient is not in any way interested how the implant looks like. He's not even interested in surgery. He's only interested in a nice smile, in a great result. And not only immediately after treatment, he wants to have that also over long term. And that's what we can achieve today. We can achieve today tissue stability around the bone over many years. And this creates a real stable and good aesthetics. Thanks to Barry Goldenberg for these beautiful pictures. I think that's what we need to go for. We should not accept bone resorption. We should make sure that the bone stays and the tissue stays, so that the smile is a good one. And when we look at this, we don't look only on implants. We need to look at the whole process and the whole treatment. And we understand today that this is a process where each step depends from the other. And if one of these steps is not fulfilled right, then it might be that you put your result under question. And that's what we want to understand. And that's all about today. That's all about the topic for tomorrow. We want to understand how we can mastering tissue response successfully. And all the lectures, and most of the lectures we see over the days, which are 100 lectures, will focus on that. We have another 160 posters outside, also having this topic. So you are able to get a lot of information here. And we also prepared a navigator. When your interest is more on prosthetic, you go to the prosthetic side. When it's more on the surgical, go to surgical, and we give you a path through the program so that you can find the proper lecture. So that's where we are. I can only say enjoy the Congress, have fun, get a lot of information back to you, hopefully valid information for your daily practice. So let's start the Congress, enjoy the Congress, and I give now the stage to David to open the first session and guide you through. Thank you very much.